Kama unalipwa milioni moja, hii maneno ya 2.5 mimi nimeona ni mzuri.
Na hiyo ni sawa kabisa kwa sababu mshahara yao iko pale na iko permanent. Pia nikiangalia kwa upande mwingine naona inaleta usawa na kweli serikali inajali mahasura.
Mimi ni mama mwenye anauzanga tu mboga. Sasa hata kwa per day naweza pata tu shilingi 300 only. Sasa ndio naweza kwenda kuangalia vile tunaweza kula kwa nyumba. Yaani aturudishie hiyo nini kiwango chini tunaweza lipa sisi kama wenye hatuwezi.
Unaenda kwa hospitali unapata kuna mahali unaenda unasikia hata hizi kadi hazifanyi kazi. Umelipia hii kadi like mwaka moja ama mbili alafu unasikia haifanyi kazi. So venye wanaongeza hii pesa mimi naona haitakuwa inasaidia mwananchi.
All right, those are a section of Kenyans reacting to the proposed rate of 2.75% for NHIF. It's just about to go up without a limit. At the moment, Kenyans pay a maximum of 1,700 shillings every month, but now that is being opened up. If you have a salary of 1 million shillings gross pay, then that will mean that you'll pay 27,500 shillings to the NHIF. Mheshimiwa Yusuf Hassan, let me begin with you on this one, because, I mean, Kenyans are preparing for the new realities because, first of all, they're coming into effect of the housing levy. It will mean that 1.5% of your salary will go into the housing levy. And it's actually of gross pay, so it's that significant. But then also, are you satisfied that NHIF rate should get to that level, 2.75% without a cap to facilitate universal health coverage and the social equality in the country?
Yes, I think first of all, universal health coverage is important, and as a country, we really need to be able to provide adequate quality health care to all our citizens. And I can speak as a former victim of the high cost of medical care in our country. The cost of medical care in our country is crippling. For example, when I was injured in a bomb explosion, I spent a considerable amount of my income and my savings to treat myself. And fortunately, I had the ability, I had the means to be able to do that.
Right.
But for millions of Kenyans, there's simply no such an ability. And it is important for the state to intervene, provide some kind of medical care that we can get in the country. And the other thing is that people spend billions of shillings in medical care outside the country.
Right.
In India, for example. And many families are completely bankrupted by the cost of medical care. So I think it is important to have a national health insurance fund that is adequate, that is effective, and can provide quality medical care inside our country. And I support this particular move in the sense that the previous payments were simply not sufficient to provide that kind of, although you are collecting money, it was simply not sufficient to be able to provide the coverage that we need. And so I think in the long term, it may impact the pocket of any salaried person,
Right.
But it is necessary. And I like also the idea that in fact they're increasing contributions for the rich. You know, society can only be transformed if you have a responsibility in which the rich are able to be taxed or can contribute more to support the disadvantaged, so that we have a balance in our country and we are able to have a more equitable society.
Who is rich according to you?
Anyone who is earning a salary is able to and can afford
contribute in accordance.
Yeah, can contribute according to their capability, according to their income. And in particular, people who are earning above 100,000 to a million can afford to pay the small percentage that has been demanded of them to support the program. So I fully support it in that sense. And I think in the long term, look at the National Health Service in Britain. You know, by global standards now, Britain is not a wealthy country. Britain used to be a very wealthy country. But the only thing that they have kept going and provided free of charge through their own contribution is through the National Health Service. Many of the European countries have got that universal coverage. Denmark, Norway, Sweden. They're able to provide for their citizens, although their economies are not big as the United States, China, or any of those other, or Japan. So I think there's nobody else who is going to do it for us.
Okay.
We have to pay for our universal health coverage. We have to pay for our education. We have to pay for our other social protections for highly vulnerable people in our community. And to be honest, there's a lot of emphasis on the inability. We can't do this, we can't do. You can also say that maybe we don't deserve to be independent and to have the freedoms that we have.
Okay.
We have to pay for those.
I hear you. Senator Nyonka, what is your take on this? And he makes a case that every person who is earning 100,000 shillings going up is, you said rich,
Yes,
and they should be
relatively
taxed.
well-to-do in our...
And they should be taxed proportionately. But what's your take when you reflect on this against the cost of living and also the other levies and taxation that measures that have been introduced recently?
I think, why can't we start from the low-lying fruits? Why has National Hospital Insurance Fund in Kenya failed? Because money is stolen from it. What has been the issue? I mean, how many scandals have we gotten from the National Health Insurance? Who doesn't know that hospitals organize and patients are taken to certain hospitals and payments are made to people who actually do not go there for treatment, other than documentation which is done and it's all fake. And that's why some of us were saying, why can't the government start this thing that they stopped again? I hope, Madam Sholei, that the president will introduce the PIN number which we are supposed to have, because the reason why you cannot control the nonsense that has been going on with the scams in these countries, because the records of everybody don't even exist. That's number one. Number two, what has been the international best practice? Let's find out what the other countries are doing. What the other countries are doing, like Honorable Hassan is saying, Britain has maintained and managed provision of health care. They have been organizing the funding. When you come to us, you look like a country like Tanzania. Why is the Tanzania National Hospital Insurance Fund functioning more effectively and providing the services? The Tanzania National Health Insurance Fund, they want to build the largest skyscraper on here in Kenya at Upper Hill. And they look at the bridges which the National Hospital Insurance Fund is building in Tanzania. What do we do in Kenya? We pick national insurance, hospital insurance money. We then put it in a scam. The whole system collapses. We employ friends and relatives. We put them in these jobs and they steal all the money. Then you call again after 2-3 years and start saying, unless there is the president of the Republic of Kenya, William Ruto, unless he puts people into this thing, who run an outfit that is bulletproof, who will make sure that health services are provided legitimately, equitably, and fairly to Kenyans. I have no problem with poor people paying more money rich people paying more money than the poor people. But what happens? It's a scam. So until I see NHIF functioning, Madam Speaker, for me, I see it as another scam.
Senator Sotsi, the impact at the end of this month, if this NHIF rate passes, whether it's effective in July or August or whichever month, there are certain deductions that are taking effect. And the salaried people, those with a pay slip, there are just 3.2 million of them, they're feeling the pinch at a time that the government needs resources to implement the programs, but also to meet its promises that it made to the people. But what do we do to the impact on these salaried Kenyans?
Sam, it's going to be hard times, because if you do the calculation, you realize that 40%, at least 40% of your salary is going to go into these taxes and levies. So which you remain with the 60%. And 60%, most Kenyans are borrowed, they have loans. The cost of loans are going to go up. Central Bank yesterday increased the basic lending rate by 1%. And the basic lending rate has now gone beyond single digit. It's now about 10.4%. So really that is going to be hard times. And I want also to support what Honorable Nyonka is saying, is that yes, increase may be justifiable, but have you reformed the NHIF? You know, we see a lot of contradiction in this Kenya Kwanza government, because on one hand, they are saying we are going to increase the NHIF rates. On the other hand, I saw the Cabinet Secretary for Health coming out to say we have cartels in NHIF and we are going to remove those cartels. So are you telling us from 1st of July, we start paying money to cartels? I can understand the thinking, economic thinking of Kenya Kwanza. Their thinking is that they want to build up domestic resources for domestic borrowing. So that they build up resources in NSSF, they build up resources in NHIF, so that when they want to borrow, they go and borrow in these institutions.
Can you really borrow from NHIF?
You can't.
Well, I have
delivery.
listened. If you listen to them talking in the past, you listen to them saying that we do not want to go and get external loans. We want to get loans locally. We want to have a saving culture. We want to build up a saving fund in this country. Their thinking is that they can build up resources where they can borrow. And I want to tell you, Sam, that domestic borrowing is not good for the economy. It's not good for the economy because it means the government is competing with the private sector on the funds available in the country.
So what borrowing is not good? From the commercial banks or even from funds like pension funds?
Even locally, it is the banks may want to access the same credit.
You said two things, that the government is introducing all these levies so that, all these funds so that it can borrow from them. You said that they may borrow from NSSF, from NHIF, but also the commercial banks. So what I'm asking is, if domestic borrowing is bad for the economy, is it when it's affecting commercial banks or even funds like NSSF?
You know, commercial banks may also have access to this. So we have a situation where the government is competing with commercial banks to borrow. So that an economist will tell you that is not good for an economy. And that is why we will end up having higher inflation rates going up. So when you look at the finance bill, you see a scenario where someone wants to get as much money as possible so that he can create a pool of resources to do what they call development. But what is the effect? What is the multiplier effect on the economy? I think that is what has to be analyzed. Because again, when you say that we are going to tax salaried people more so that to support the poor, remember these salaried people have dependents who are poor down there. So if you put me in a situation where you are overtaxing me and I have dependents, how well am I going to help those dependents down there? So we have to look at these things holistically and see the economic effect or the social effect on the people of Kenya.
Deputy Speaker, so he makes a point about the saving culture, which is true. It's an agenda that the president has been advocating for. But you're looking at NHIF that recently has not been able to disburse funds to hospitals. Why? Because the money had been rerouted from what it should be doing to funding government services. And this was an admission by CS Nakhumicha, who came out and said as much. So how and why should Kenyans trust that NHIF will do what it's supposed to do, even with more funds that they want from the Kenyans?
Okay. Before I speak on the NHIF, let me just set the record straight on the issue of borrowing. Yes, the government has said that will cut down on borrowing from international financial institutions. Foreign borrowing.
You have already overborrowed.
Allow me.
External.
That's the position the government has done. The government has a plan that has said that they want to provide universal health care for everybody. They want to be able to provide scholarships to students who want to go to university from needy families and so on. So they have all these dreams, but they have to find the money to finance all those plans from somewhere. And there are only two places that you can get the money, either from taxes or from borrowing. And because the government has capped on, wants to reduce over time our international borrowing, then we have to raise more money within the country, because that's the only other way. And so, and when they talk about, and the other plan that the government has put in place, which already began, was that they want to focus, they don't want to borrow, they want to undertake domestic borrowing. Because when you borrow from locally, first of all, it's an expensive loan. That if you borrow from the international financial institutions, then you're probably doing it at 1% and over a very long period of time. Whereas local banks, it will be 9%. Previously, local borrowing was ongoing because certain people benefited because they owned banks. And now that is being cut on. So even if there is borrowing, we will try and borrow from the international financial institutions. There is also simultaneously on the international trade negotiation trips that the president has made, he is also having a discussion about changing the international financial system so that it's not to be favorable, more favorable to Africa. So all this is, you can't transform a country in one swoop. There has to be certain deliberate interventions, and those are ongoing. So that is what is happening. First of all, the government cannot borrow from NHIF, that's one. Number two, the government cannot borrow from NSSF or from the housing levy. They each have their own designed way of where the money is supposed to go. That is why it is tax specific. It's not a pool of money that goes to the National Treasury. These go to a different fund. NHIF is an independent fund.
Unfortunately, CS Nakhumicha
No, I want to. What happened to NHIF was not borrowing by the government. Let me explain what happens at NHIF. NHIF, it has a structural problem. And I know that there is plans to transform NHIF. A challenge with NHIF is one, there is corruption when they are accrediting providers. So that certain hospitals who pay bribes to NHIF officials get accredited. So that they channel all patients to that hospital. You just listened to the gentleman on TV, one of the members of the public. He said, unaenda kwa hospitali, unaambiwa hiyo kadi haifanyi. Then you're sent to another hospital. It's deliberate so that they channel traffic to certain hospitals. I have recently raised the issue where for IVF treatment, fertility treatment for women, certain hospitals were exclusively accredited by NHIF. And you would find that people would be leaving one city to another town so that they can go to a specific hospital because that person has favor with the NHIF cartels. So that must first, in fact, the position is you should just accredit the hospitals, especially if they've been approved by the medical board and all this. Why should you choose? Why should there be somebody sitting on a desk deciding this hospital, the Missouri, this one is not? First, in fact, it even costs NHIF more money because they spend almost 60% on administration. So that's some of the things. And for me, I'm happy to pay the extra money to NHIF, and I'm confident because I have seen that the CS and the president are very clear. They know what I'm saying. They are very familiar with it. In fact, you hear it from them. You find that even on the issue of approvals, when somebody goes to the hospital, you have to, sometimes the limit is maybe 150. You want the limit to be increased to a certain amount. Again, you have to get in touch with someone on a desk at NHIF who then says, okay, we are increasing the limit. You're leaving too much power to certain people, therefore you're creating cartels. So if the CS Health, as she has promised, deals with NHIF, it's very simple structures that need to be changed there, and NHIF will work. It can work. But I am not a pessimist who will say, okay, we will not contribute this because corruption is there. Let us contribute, but let us, as members of parliament and the Senate, you're the ones who, health is devolved. If you did your work very diligently and made sure that you're interrogating and oversighting, we can actually get rid of these cartels. We can demand that these changes be made. And the problem of NHIF is historical. Okay. NHIF has had challenges of corruption-related challenges, okay, and that's why it has not worked. It's not because the NHIF cannot work. And today, I always say, if you tell me, even if you tell me pay 50,000 shillings a month, I will pay to NHIF. Why? If I look at my phone now, the amount of money I contribute, my family members, my constituents asking for Harambee, by the time you look at how much you've contributed at the end of the month, it's more than that. So if I'm going to pay that once, and I never get a phone call about contributing, it's good. And it's
Deputy Speaker, and that's the reality, probably not in the same magnitude because you're a state officer and a public official elected by the people. But there has been a hit on the Kenyan taxpayer, I mean, the Kenyan payslip holder, because if you look at the taxes, I mean, it's mandatory, you have to pay tax. And recently, through the Finance Act of 2023, there has been extra bans that have been introduced, 32.5% for people between 500,000 and 800,000, 35% for anything beyond that. The housing levy, 1.5%. Consumption taxes have gone up. That's talking about VAT, excess tax on some of the products. These are people who most likely, maybe they have a loan or they have a mortgage.
We all have loans.
Yes, exactly. And the rate, the lending rate is going up. Then you're saying that they also need now to raise the NHIF contribution. These are people also, probably the employers are providing them with the medical cover, which they also contribute a certain percentage. But also you're saying they take their children to private schools, so they don't benefit from the taxation taken by government. They don't benefit in terms of education financing. You've also told them recently that because of the new university funding model, they'll be benefiting up to 38% of university fee from government sponsorship. The rest is either they take a loan of 55% or the family funds them up to 7% or more. So what are you telling them? With all this weight that they're carrying on their shoulders, what are they supposed to do?
The reality is, and that is, the reality is that Kenya has gone through difficult times. We are in a bad place economically. If something is not done, we are at risk of defaulting on our loans. And if we do, then there'll be austerity measures, and then we'll be a failed state. So as Kenyans, as a patriotic Kenyan, I would persuade Kenyans that let's do anything to save our country. Kenya has immense potential as a country. We can be like the countries that we admire, the Singapores and so on. But certain difficult decisions have to be made now. And that's why we ask ourselves, do you want our country to be a country of slums? Or do you want our country to be a country where people have decent housing? Then we have to pay the housing levy. We tell ourselves,
at whatever cost.
Do we want...
So at whatever cost.
What's the reverse?
I've just enumerated.
No, do you want this? It's a choice. Do you want the slums? Or we pay the cost of making sure that we eradicate the slums and in the process create employment. The other question is, do you want a country of sick people? And believe me, until you have a member of your family sick and then you realize the cost of healthcare. My father was recently sick. Thank God he's much better now. Believe me, the cost is astronomical, and you don't realize it until you're paying for a member of the family who does not have insurance.
And that is why I'm telling you that these payslip holders, because they have also sick parents, sick relatives, they have taken medical covers for them.
Now they'll make a saving because now you won't be paying the money for the sick person because everyone will have medical care.
Honorable,
if everyone has medical care, it eases the burden on my payslip. Yes.
Yeah. Honorable Hassan, if
people have employment, it eases the burden on my payslip because my members of my family who are not employed then don't have to depend on me. So in the long run, it's beneficial to me. Let's stop being short-sighted because anything good has to come with time. It's not going to be overnight, but you must feel the pain. Yes, and anyone who's had a child and is a mother,
I hear you saying
you can't have a baby without some pain.
Okay, indeed. I hear you saying that everyone has to carry pain, but if you look at those informal employment, they're just about 3.2 million. Those in the informal sector, they're more than 16 million, but the burden appears to be being heaped on those 3.2 million.
Yes, but they're extremely privileged Kenyans if you have a job because there's 16 million Kenyans without jobs.
Okay. Honorable Yusuf Hassan, you made a case of NHS, the National Housing Service of...
Health Service.
Health Service, rather, of the UK. I'm looking at how their funding is done, and majority of the financing appears to be more than 80% is from taxation. The national insurance contributions is just less than 10%, and then there are patient charges. I don't think that's the same model we have here in Kenya, but how do you use the lessons from NHF and NHS, because they still are not there? There are several complaints, there are several strikes by medical workers.
You know, we have problems. We have teething problems in many of our institutions, and some of the problems have been highlighted by our colleagues. Issues of corruption, issues of wastage, issues of nepotism. These things have to be really handled by the government for us to move forward. As we speak now, we have an economic crisis, a global one, a national one, and in the past 2-3 years, Zambia has fallen off the cliff. It has defaulted. Ghana has done the same. In other developing countries, Sri Lanka has gone down. And if we are not careful and implement a serious recovery program, we would be there. And the consequences for the Kenyan worker, the consequences for the ordinary Kenyan would be beyond belief, because there would be unemployment, there would be a social and economic breakdown, and therefore the recovery program initiated by the current government would help us to fend off from that particular process. Now let's talk about the issue of change. You know, housing levy, the National Hospital Fund.
Right.
So I am elected on a social transformation and change manifesto platform as a member of parliament. I have a manifesto, a 10-point program, in which was based on the aspirations of the Kamkunji people. Kamkunji is 50 or 60% informal settlement. The cry there is to improve the informal settlements, to create opportunities for affordable and social housing, to create an urban development program. And all these programs are under the housing and settlement program and can only be paid for the housing levy. The same thing with universal health care is that the universal health care, one of the factors is free maternity. A significant percentage of my population, young women, are single mothers. The system provides them with free maternity help. It provides some kind of medical coverage for the elderly and the severely disabled. We are developing capabilities for cancer, coping with cancer and other deadly infectious diseases. And then if you look at education, you know, we're providing bursaries for the needy. We are developing and expanding our educational system. We have thousands of kids in primary and secondary schools. We're building new secondary schools. We built a technical college. And then another aspect of the program that I have supported, because of my own conviction and because it is in line with the aspirations of the people I represent, is poverty eradication and equity, funding women and youth programs, helping kickstart our digital revolution, investing in the creative economy. All of this is provided for in this budget and the finance bill. And when you ask people, how are we going to have all of this if we don't have it?
Okay.
They don't give you a solution or an alternative program. So what I'm saying is that, of course, there would be costs. Of course, we have to pay. The model that I'm talking about may not necessarily be exactly as the National Health Service in the UK, because no one size fits all.
Right.
We would develop our own.
But let me ask you, Honorable Hassan, because you sit at the National Assembly, which you have sat since, is it 2011?
2011.
I see some statistics online that Kenyans spend up to 150 billion shillings on hospital bills, out-of-pocket expenditure. And Kenyans also pay a lot of taxes, up to the tune of, say, 2.1 trillion shillings. Is it not possible to prioritize our budgeting so that the taxation, even if it doesn't cover everything, at least those are the basic services that Kenyans would expect at their public hospitals?
The challenge with NHIF was that it was not a mandatory...
Sorry, I was posing it to Honorable Hassan.
Yes, I fully agree.
Why do we have to keep introducing new levies each and every day, yet Kenyans are still paying taxes?
No, I mean, the housing levy is absolutely necessary. If you want to eliminate the informal settlement, if you want to eliminate slums, you have to pay for it.
I'm specific on the cost of medical care,
yes,
which is estimated at 150 billion shillings. Clearly, this can be found within the 2.1 trillion shillings taxation collected from the Kenyans.
It cannot.
Why?
It cannot be funded because you need investment in new medical facilities. You need to provide medicine to hospitals on a continuous basis. You need to train and develop medical expertise in areas that we're not able to cope with at the moment. And we need to create a better hospitals and medical facilities that would cut down the cost of healthcare of millions of people, thousands of people going overseas.
But you see, Honorable Hassan, the irony
you can get the same type of quality treatment in our country. And I think this investment used very well. I mean, the question you're raising maybe is that the resources that we have are not used very well because there is corruption, there is wastage and so on. That is another debate. We must be able to tighten and control. And the challenge that this president is going to face, having created all these tax areas, is that he must also reassure the Kenyan public that the money that they pay for the housing levy, the money they pay for the National Hospital Insurance Fund, the money they pay in taxation is going to be protected and used for the purpose it is required. That would be the biggest challenge of the Ruto government between now and 2027. And the Kenyan public are watching. And they would make sure that, in fact, if that does not happen, that there would be political consequences come the next election.
Indeed, but Honorable Hassan, I get your point that we spend money to train, but it is changing because they are saying that unless you're vulnerable and poor, at which time you'll get total funding, 100% funding from the government, if you have a pay slip or if you are able, according to the assessment by COOPS and HELB, is that you will have to meet the cost of your training up to 62%. So if that money that taxes are being paid is not going to train a medical worker because the family will cater for that or they'll get a loan from HELB, then what are you saying?
But have you looked at our budget, the breakdown? Look, for example, in 600 billion plus.
To education.
It goes to education.
Right.
Where does that money go to? It goes mostly to salaries of teachers. If you look at the money that goes into the health department, a considerable percentage of the money that we pay to the health ministry is to doctors and nurses' salaries. So a lot of our money is going into just keeping those people at work without any improvement in the quality of the services that they provide.
All right. Senator Sotsi, your take, because like you said, the impact will be felt, but how do we make sure that continuously, because yes, it appears that all of you agree that we're in that crisis, which is real financial crisis, that there are certain things, we have obligations that we have to meet, but what do we do so that progressively we do not have to continue increasing, maybe soon we might have water levy to finance dams construction. What do you do to ensure that taxation is sufficient to finance the public goods?
Sam, I believe that the current taxation, even without this finance bill, is sufficient to do all the things that we need to do. The problem we're having in this country is misuse, misappropriation of public funds. And I think that's where a lot of focus needs to be put. You have seen even some people, some economists within Kenya Kwanza have questioned the spending habits in the government, that there is a lot of wastage of resources, and I think that is where we need to start from. we need to ensure that the public funds are utilized in the right manner and for the targeted projects and programs. That way we'll be able to address that problem without taking the easy route, which is to tax Kenyans. And that's why most Kenyans are against this taxation plan, because Kenyans have no problem being taxed, but they want to see where their money goes. Where does our money go to? If we see we are being taxed and things are being done in the right way, we will not have a problem. But we are in a scenario where we are being taxed, and the next thing we hear of scandals. Some, the other reason why Kenyans are very concerned about all this plan is because anything that this government has touched on as a solution to address Kenyans' problem has not worked out. Remember, they told us that a solution to food prices is importation of cereals and edible oil and all that. You have heard what has happened. The corruption in the Kenya National Trading Corporation, where tenders were given to some powerful people at very inflated rates. They told us that a solution to addressing high petroleum prices is getting into a government-to-government deal with Saudi Arabia. We saw the deputy president in Mombasa receiving petroleum product that had been shipped to Mombasa. And we were told, in the next 1 week, mutaona mafuta imeteremuka. Instead, the prices of petrol has gone up. So when we are asking, are these things being done?
I'm not sure he said that, Senator
Yeah,
if I remember correctly, he said that we will start seeing the dollar rate coming down.
Has it?
Not
Has
the
it?
price of it.
Has
It doesn't happen
It has
overnight.
not.
It hasn't. It hasn't.
He says it
So
doesn't
all
happen overnight.
all these things that are coming up, all these haphazard policies that are coming up with as solutions to the problem affecting Kenyans, we are not seeing results. Instead, we are seeing the opposite. And that is why even this finance bill, as I said, they needed to look at the multiplier effect of the proposals that are put in the finance bill.
Okay.
Because it is going to hurt Kenyans in a big way. When you see the prices of petrol going up by, because of the 16% VAT, by about 10 shillings, then everything else will go up and up, up and up.
Okay.
Then the next thing, the inflation rate will go up and up.
Yeah.
And that means the economy will not get the benefits that it's supposed to get.
We have the next 1 month to see the impact. I'll get back to you, but let me first take a look at what Kenyans are saying on Twitter. Citizen TV Kenya Sam Gichuku, the hashtag to use is daybreak. A bit of feedback, especially on the current conversation, touching on the pockets of Kenyans. Do we have that so that we can take a look at it? But also, one, just as Olumi is saying that let Honorable Gladys not criminalize those in formal employment. It's not a privilege. The unemployed still depend on the employed. Don't burden the working class. You're working on increasing the number of poor people and masquerading sad. Okay. Engineer Lazaro saying that government should first of all consult on NHIF before making grave decisions. Additional taxes or deductions might chase investors, scare away local entrepreneurs, and even incite hustlers against the working class fellows. Okay. Again, just as a loan, this government is taking us for a ride on this. Currently, I'm paying about 1,350 shillings per month, and there's nothing NHIF is helping with. Settling bed cost is a joke. Let the government look into NHIF management. It is scandalous. Babu Michael, there are some things that happen in this country and you just wonder, how can a CSA NHIF kitty doesn't have money because the country is broke? This simply means this money was taken and diverted to other public uses. Is it really fair? Tikasan, I think it would be wise for NHIF to allow hustlers to use the cover in any hospital, not being confined to one hospital. Let Kenyans get value for their money. Babu Michael again, new financial year realities are just about to be realized. For now, there is no reverse gear at the moment, but just to wait and feel its merits and demerits. They said they passed finance bill in the interest of the people. Let's wait and see. Mogire Jaspam, the greatest problem in Kenya is that our leaders believe that borrowing more money, throwing more money at problems facing us solves them. Tanzania, Uganda, and other countries run smaller budgets than ours and are doing well. Prudence, integrity is what we lack, not money. And Honorable Lilian Sioi, county government crisis that they are financially broke. MCA's demand for more salary, payment and allowances. What will those who even can't afford 2 meals per day have to do then? Okay. So Nixon Dugire, we honestly don't have a choice now but to go through the high tax pain. However, the government should also go through the pain of removing public funds thieves, regardless of the bond between them. And again, Babu Michael, you're so lucky this morning. Can someone like Boshele there tell me, because she's in government now, how can NHIF funds, which are collected every month without fail from numerous institutions and people, at the end they said is not available and hospitals turn people away. So clearly you can feel the mood of the viewers on Twitter and what they have to say this morning. But of course, they're not everyone. Senator Nyonka, so with all these new things that are coming on board, she says that it has to take a bit of pain. What assurance do we have that Parliament will be there for the people to make sure that whatever government commits itself to doing is done, and if not, action is taken?
I will say this. I have watched, I think, reasonably in this country now for about 20 years on what happens. And for me, I want to plead with my High Excellency Deputy Speaker. Because you are in government now.
You two are.
We are in Parliament, me and you.
Hold on. You are in government.
Oversighting.
First of all, members of the National Assembly, even members of the Senate, don't understand that they have a critical responsibility to oversight the government. They should not be in bed with the government, but they don't understand that. We agree, it's okay. It's a problem with our democracy. Number two, the issues that are in this country, which everybody watches over and everybody knows about, and I think this is, Sami, this will be the 25th time I've said this. If William Ruto doesn't fix it, nobody can. Why? He's been there. He knows the crooks. He knows the thugs. He knows the dealers. He knows the scammers. He knows everything about this country. He's going to either decide that we're going to have a country that we observe the rule of law, that we are going to be a country that actually provides services to our people. He knows the historical data and information as to how much money is going into wastage, how much is being stolen. You know, look at NSSF, Sami. The National Social Security Fund. Everybody knows what NSSF is supposed to be doing. Everybody knows what NHIF is supposed to be doing. Look at where we are today. We are looking and dealing with the same issues we've been dealing with for the last 20 years.
Right.
So, for me, all these things we keep talking about, all these issues we keep talking about, all the taxes. In fact, Honorable Hassan, you are very well educated. Adam is very well, even this guy. Me, I don't mind. Increase the taxes. Let the president increase the taxes to whatever he wants, if he feels that is the solution to solving the problem of the country. But let the government know that some of us are saying some of the strategies and the approach that the government is laying down to try and solve the problems, they are either convoluted, confused, or nobody knows what is going on. Let me explain to you why. I'll give you an example. How much money have we borrowed in the last 8 months? We are at $1 trillion. But the president has been saying we can't borrow. He has borrowed $1 trillion shillings, and we have not even paid for our fuel. We have a debt of close to 600 billion shillings to be paid in the next 3 months. Okay, so if these taxes don't generate the revenue that the president is going to use so that he can start paying the taxes, and pay the debts which we are borrowing as we are today. We have been talking about our loans need to be rescheduled, our loans we need to go to the international money market. Make sure we borrow at lesser interest rates. Make sure we bring in the dividend that borrowing at the international money market. Right now, the interest rates in America and Britain, they're at 4%. We are still borrowing at 11%. When you look at what is happening in terms of money being released to the county governments, the exchequer releasing the funds, having a possibility that we can have even the economy beginning to grow from the county governments and at the national level, because you have got to bring in expenditure so that the money can circulate, so that people can have money to. Even when you sit and look at the policies, what are we actually doing about young people?
Okay.
What are we discussing? What are you? I watched news today. I've looked at the newspaper. You are saying that our president is moved in. He's now talking with border people on what he's going to do. My brother, in Kisii, border riders are 160,000. Why can't we devolve and go to start this problem from the county government? Right. Why am I not feeling that there's a policy where the government can work with the county government with a clear direct engagement to try and solve the problem of the borders? Look at National Hospital Insurance Fund. Why are we having NHIF domiciled in Nairobi and the health has been devolved to the county governments? Because in Nairobi, the money can be eaten easily. Nobody follows it up.
Right. And Deputy Speaker, you told me that it is not possible that a president elected by the people would lead an executive that proposes policies that are not pro the people. And if that is true, I listened to Senator Onyonka, and you'd be forgiven to believe that he's quite frustrated in the current framework. I mean, how we have the majority versus the minority.
Yes, I'm frustrated.
But in this first year of the Kenya Kwanza administration, what is the certainty that you'd give Kenyans that indeed, whatever the government is doing, whatever Kenya Kwanza is doing, they'll get value of every coin that is contributed in taxes, in levies, and whatever else sorts of resources?
I think the confidence that Kenyans should have is that these plans and decisions to include certain levies and taxes in the finance bill and even include some reductions is not out of the blue. It is based on a well thought out plan. That's one of the things that first gives me confidence. Number two, I choose, like I always say, to be an optimist. I'm not a pessimist. If someone says, I am going to undertake the following interventions because I believe with those interventions I'm going to have the following result, give the person the benefit of doubt. So that, but if we start saying it will never work, then it means we'll be paralyzed as a country and never move. Yes, and I like what Senator Onyonka said.
We have agreed.
That let it be taxed provided it's used well.
It's working.
And that is what all of us, nobody wants to pay tax and know that it's not going to be used well. So we say that, and that is why we must be vocal about it as leaders. We must hold those who are managing those resources to account. In being in Parliament, you have the power to summon the CS Health before the Senate and ask those questions in public. So if we must play our role, instead of complaining, let us activate our oversight role. We cannot be whining and complaining like an ordinary citizen who doesn't have the oversight capacity. The people of Kenya have elected us, put us in these positions so that we can ensure that money paid to NHIF is used well, that money that is paid for the housing levy is used well. The housing committee in Parliament can decide to summon every second month or every month to get an update. You collected 30 billion this month. How many houses have come up? It is their job to do it.
Right.
So if we do our job right, believe me, we can't even be complaining the government this and the government that. It is our job to check government.
Okay. And I think that's a good place to leave it at because we are past the hour. I have to thank your Deputy Speaker, Gladys Bose, Mheshimiwa Yusuf Hassan from Kamukunji, Mheshimiwa Senator Godfrey Sotsi from Vihiga County, and Senator Richard Onyonka from Kisii County for making time for us to have this conversation. And like we told you earlier on, of course, the impact of what has happened the past few weeks and months will be felt starting this Saturday, the 1st of July. And for those that are payslip holders, you have a date at the end of July. But also your voice must remain heard, that you have to express yourself, and also parliamentarians here are committing that they will be there for the people. Idil Adha. Okay, all right. Thank you so much, and all the best with your celebrations. My name is Sam Gituku. Up next is Matters Social. Willis Raburu will be here. I wish he was here. Wow. That is Senator Onyonka leaving the studio. But I wish Raburu was here. He's been a great partner in crime, especially here on Daybreak. I think the first time I came on this show, I found him here with some other colleagues, and it has been a great pleasure and honor to work with him as he departs. Willis Raburu, I know you're watching. All the best wherever you go. But all the same, bye for now, and we hope to hear from you. See you some other time.